Hi, I am Michael Gold. I am the Michael E. Assey Professor of Medicine and a cardiac electrophysiologist at the Medical University of South Carolina in Charleston. I'm pleased to be here today to talk about the Smart-CRT trial. Cardiac resynchronization therapy is a very successful treatment for many patients with a low ejection fraction and heart failure in the presence of QRS prolongation. There have been many attempts to optimize CRT, and the one treatment which is most relevant to this study is the idea of AV optimization, or changing the intervals between the atrial and ventricular pacing in these devices. And early studies were somewhat disappointing with this, so that AV optimization is no longer routinely recommended. However, newer approaches to AV optimization using electrical measurements to try to fuse pacing from the left ventricle with normal activation in the right ventricle appears to be a more successful approach. The early studies of this showed a signal towards benefit, although they did not reach statistical significance. And this led to some subgroup analyses, and the different studies looked at different subgroups, suggesting that the benefit may be most apparent in certain groups of patients, such as those with left bundle branch block or some other characteristics. The characteristic that we were found to be most useful is in those patients who have electrical delay, so that we achieve more electrical resynchronization by pacing. And we measure the electrical delay by looking at the time between the activation on the right ventricular lead and the left ventricular lead, or the so-called RV-LV interval. And in those patients with long interventricular delays, there is a much greater benefit of AV optimization that we found in a retrospective analysis compared to those with just nominal settings.